So, hello everyone. So, this is the session of the general anatomy of the bone which has been started. Actually, general anatomy of the bone session I have already started study evening. So, a part of it is still remaining. So, I would like to complete the rest important part in this session. So, am I audible? Is the screen clear so that I can start the session? Let me just check. Okay, so yes, I am audible and everything is okay. So, yes, now we can have the session now. Okay, so this is exactly the session completion of the part 1 of the bone general anatomy which we have already started studying. So, let me just start with the session now. So, before starting the session, I would like to tell you about myself and about the platform of Unacademy. Myself, Dr.Monalisa, MD Anatomy from Armed Force Medical College, Pune, and I am here to discuss the important features of the bone, general features. And before starting, I would also like to tell, though I have got a total of 8 to 9 years of teaching experience for various competitive exam in the medical field. I would also like to tell you about the special class features where the students can interact with the educator and they can ask their doubts, and their doubts can be cleared right itself in the session. Polls are conducted and you can ask the doubts live with the learner. Raise your hands and get your doubts cleared in the session itself. You can follow the educator if you like their session, and after following on the Unacademy you will get the notification of all the sessions taken by the educator. Never ever miss a session. For example, if you want to see the session and you want to follow that educator on the Unacademy app, you are not going to miss that session if you are having the notification of that session. So, always you will get a notification if you follow the educator on the app. After the session is completed, you can also download the lecture notes anytime, anywhere, read from the top educators of Unacademy platform. So, all these benefits can be taken by you if you see the session on the special free platform of Unacademy. Now, today I am going to take two special free sessions. One is at 6 p.m. and the other is at 7 p.m. So, this is the histology MCQ session part 1 and part 2nd and part 3rd, which you can assess. The code is ANAT10. So, by using the code ANAT10, you can add on this free session and you can attend this free session. So, interested student can definitely join for the special free session on today evening 6 and 7 p.m. This is the whole detail of my all special free sessions on the Unacademy platform. The timetable is shared with you. Now, let's talk about the plus subscription. When I am talking about the plus subscription, all 19 subjects are completed in a very systematic way. You can study from top educators of medical field. You can also compete in live tests and quizzes. You can study on the device of your choice. You can assess more than 25,000 MCQs. These all are clinical MCQs based on the latest pattern of examination of all 19 subjects made by the top educators of Unacademy platform, those who are having more than of 8 or 9 years of teaching experience. And also you will be provided with the printed notes of the plus subscription if you are taking the subscription of more than 1 year. Let's talk about Iconic subscription. In Iconic subscription, you can access the two best platform. One is the Unacademy Plus platform, and another is the Prep Ladder. That means you will get the benefits of the Prep Ladder, clinical integrated essentials, video lectures from the Dream Team, QBank 3, rapid revision, snapshot and treasure dream notes. All these can be assessed by you and this will be highly beneficial for you. So, you can grab this opportunity and take the benefit of taking Iconic subscription. So, before starting the session, I would like to show you this slide where the comparison of the pricing detail of Plus and Iconic has been compared. You can use this code, discount code, and get 10% additional discount. Already it is discounted at 10%, additional 10% discount can be gained by you. So, just grab this opportunity. Now, let's talk about the learning objective. So, actually this is the learning objective of the session, and the parts which have already been covered up in the previous session is the parts of the long bone we have covered up. Long bones blood supply, types of epiphysis has also been covered up. So, today sysmoid bone and certain points about ossification and pneumatic bone is remaining, and certain clinical aspects. So, let's start with the sysmoid bone first. So, first thing is that sysmoid bone, as we know, it's not a true bone. It's a bone which is developed in the tendons of, it develops in the tendon of muscles. In certain muscles tendon there is a bone formation that is called as sysmoid bone. So it is not a true bone. Why not a true bone? Because there is absence of periosteum. So there will be absence of periosteum layer of the bone. That is the outermost covering layer, that periosteum is absent in the bone. Other than that, what is the function? So actually it develops in the tendon and it will reduce the friction and also wear and tear. So these are the functions, and it is important for your examination point of view that you should know example of important sysmoid bone location. So let's start with this. So one of the largest sysmoid bone which is shown here is the patella bone. So patella bone is the largest sysmoid bone. Patella bone is largest sysmoid bone. Patella bone is the largest sysmoid bone. And where it is located? It develops in the tendon of which muscle? So if you will see, the quadriceps muscles has been shown here. So we know that quadriceps muscle is actually made of 4 muscles. So it develops in the tendon of one of the muscle of anterior aspect of the thigh, that is the quadriceps femoris muscle. So it develops in the tendon of quadriceps femoris muscle, and we know that quadriceps femoris muscle is made of 4 muscles: vastus medialis, lateralis, rectus femoris and vastus intermedius, and this is the largest sysmoid bone. Now there is another diagram where you can see a red color arrow is marked on a small bone. Can you see on the posterior aspect of the knee joint? And this small bone which you are seeing, this small bone, this is the another location of sysmoid bone. Actually this bone is fabula. So what is asked in the MCQ is what is the location of fabula bone? So actually this fabula bone develops in the tendon of lateral head of gastrocnemius muscle. It develops in the tendon of lateral head of gastrocnemius muscle. So write down fabula bone develops in the lateral head of gastrocnemius muscle. So this is the another sysmoid bone example. So we are continuing with the list of all the sysmoid bone location and where it is present. So let's talk about the other one. So I would also like to show you this diagram where you can see the location of the 4th ear ossicle, and this 4th ear ossicle is also called as sysmoid bone. So let me just highlight this image. So yes, if I highlight or enlarge this image, you can clearly see here. So you can clearly see here the location of the 3 ear ossicle. So you can see here, this is the malleus. This whole outline is of malleus bone. This is the malleus bone and ear ossicle. Now the other one which you are seeing is the incus. So this is the incus which is shown, and this incus bone is articulating with the other bone, that is the stapes. This is articulating with the stapes. This is the foot plate of the stape. Now here you can see there is another bone that is shown here at the important location of here shown is the lenticular process of the incus. So you can see here the lenticular process of the incus, and the lenticular process of incus is considered to be the 4th ear ossicle. So we have got 3 ear ossicles, malleus, incus and stapes, and the lenticular process of the incus is considered to be the 4th ear ossicles. It's an example of sysmoid bone. Write down lenticular process of incus bone is another example of sysmoid bone. It is considered to be 4th ear ossicle. Now, so in this diagram you can see the red color highlighted bone. Again, this small bone which you are seeing is the pisiform bone. Pisiform bone is also an example of sysmoid bone. Why it is considered to be sysmoid bone? Because this muscle develops in the tendon of flexor carpi unlaris. So this bone develops in the tendon of flexor carpi unlaris. So pisiform bone develops in the tendon of flexor FCU. What is FCU? Flexor carpi unlaris. Okay, now moving on to the next. The other sysmoid bone location. The other sysmoid bone location is the sysmoid bone present in peroneus longus muscle. Sysmoid bone present in peroneus longus muscle. So you can see here you can see the tendon of peroneus longus muscle, and in the peroneus longus muscle you can see the location of two sysmoid bones. So this is another example. So peroneus longus muscle, when it is passing to the inferior aspect of this cuboid bone, this is the bone, this is the cuboid tarsal bone. So this is another example of sysmoid bone. Write down peroneus longus tendon. Contains sysmoid bone when it is binding or going towards the cuboid bone. So you can see here the location of other sysmoid bones in the sole also. So actually in the foot we have got two sysmoid bones, another two sysmoid bones that is located at the distal end of the first metatarsal. So at the distal end of first metatarsal. So write down distal end of first metatarsal bone contains two sysmoid bones. Actually, the sysmoid bone is lying in the tendon of which muscle? FHB. What is FHB? It is flexor hallucis brevis. So sysmoid bone develops in the tendon of flexor hallucis brevis. So this muscle is flexor hallucis brevis. So if you want to write the full form, you can write it here. FSH means FHB means flexor hallucis brevis towards the great toe. Okay, these are the important sysmoid bone locations. So have I missed some? Okay, of metacarpal also, few examples of metacarpal also. So please write down here itself. Okay, so I would like to give you the example here itself. So write down in the hand. The location of other sysmoid bone is in the distal part of first metacarpal. So in the distal part of first metacarpal bone, we have got the location of other sysmoid bone. The important examples are the sysmoid bone, which is located in the distal portion of first metacarpal. It is located in the tendons of adductor pollicis and flexor pollicis brevis. So that important examples you should know. This is always asked in the examination. So it is present in the tendon of which muscle? Adductor pollicis muscle, going towards the first thumb, going towards the first finger. Okay, that is the thumb, and the other is flexor pollicis brevis. Flexor pollicis brevis. Okay, yeah. So these are all locations of the important sysmoid bone, and I would also like to show you a diagram where other important sysmoid bone location has been shown. So there is a diagram here which I want to share with you. This is the important sysmoid bone which has been found in the radiological image of the hand, as you can see here. So we have got in 99 to 100% of cases we have got sysmoid bone at the distal end of first metacarpal, and we have just seen that it is found in the tendons of adductor pollicis and flexor pollicis brevis. Also in interphalangeal joint first, we have got in the second metacarpophalangeal joint 40 and 60% cases, also in the interphalangeal joint 0.5% cases in the fifth interphalangeal joint. So with this diagram you can see certain important location of sysmoid bones in the fingers. So done with this. Now let me tell you in briefly about the types of ossification. We have got two types of ossification. One is called as the intramembranous and other is enchondral ossification. So actually it is important that we should know the basic difference between the intramembranous and enchondral ossification. When I am talking about the membranous ossification, it means the bones are first laid down from the mesodermal connective tissue, and through the mesodermal condensation directly the bones are formed. In the second category, after the mesodermal condensation, cartilaginous model is there, cartilage is formed, and then the adult bone is formed. So see here, two types of ossification. The intramembranous ossification, bones are directly developing from embryonic mesenchymal tissue. The example of bones which is forming from the intramembranous type of ossification is the bones of cranial vault, mandible and that of clavicle. These are the important bones which is undergoing the process of intramembranous ossification. So bones of parietal bones and all the bones of the vault and also the bones of the face, all these bones goes for the intramembranous ossification. The second categorization is cartilaginous ossification, in which cartilaginous model is formed firstly from the mesenchymal tissue and later on the process of ossification and formation of bones takes place. So this is a two-step process, and if the bones are directly formed from the mesoderm or mesenchymal tissue, it is intramembranous ossification. So here in this diagram, I would like to explain the 4 steps of intramembranous ossification, which is very beautifully described in this image. So let me just enlarge this diagram. Okay, the first step is condensation of mesenchyme into soft tissue, and the blood capillaries start permeate in this first step. After that, the second step is deposition of osteoid tissue is done by the osteoblast present in the mesenchymal surface. Osteoid means matrix is formed, and when the osteoblast ke sath matrix is formed, then it leads to the formation of osteocyte or mature osteoblast. Later on, the initiation of the process of formation of periosteum also started in the second step only. The third process is, as you can see, inside honeycomb appearance or spaces of trabecules appears. Okay, the next step is formation of creation of spongy bone and also deposition of minerals takes place. So this is the first step. As you can see, directly condensation of mesenchyme with the blood capillaries permeation. The second step is osteoblast will start formation, later on around the osteoblast matrix is formed and osteoid starts to form. Also the process of periosteum starts to form. The third process is trabeculae or the creation of spongy bone, and the fourth process is the surface bone is filled with bone deposition. Periosteum of spongy bone is coming to the middle aspect, and later on more and more matrix is added on, and this is the fourth process and the process of formation of bony bone. Actually, so here what you can see, the cartilage is not formed in the intermediate step. So directly the bones are formed from the membrane or mesodermal model, you can say, or it is a directly the bones are formed from the mesoderm. So this is called as intramembranous ossification. So an intramembranous ossification, as we know, it is taking place in the flat bone of the skull and the clavicle all part, but not the sternal aspect. So membranous ossification, as we have just seen, important membranous ossification. The bones undergoing membranous ossification is which type of bone? The bones which is going membranous ossification is bones of skull vault. Other than that, we have gone bone like parietal bones, bones of face, mandible, clavicle, mandible and clavicle. Now, this is the one category. The second category is cartilaginous model of bone formation. Cartilaginous model of bone formation. Now, in the cartilaginous model of bone formation, what happens? The first thing is mesodermal condensation takes place. The first step is mesodermal condensation of bone start formation. Then there is cartilaginous model is formed, and the next step is, so in between or intermediate step is cartilaginous bone formation, and then the mature bone is formed. The cartilaginous model of bone formation is called as enchondral ossification. This process is called as enchondral ossification, and the bones which is undergoing cartilaginous model and enchondral type of ossification, the bones are the bones of vertebrae bones, the bones of limbs and that of thoracic cage. bones of thoracic cage. So I would just show you a diagram which the steps of enchondral ossification has been shown. So let me again slightly enlarge this diagram. Okay, my dear aspirants, so I have just enlarged this diagram. When I am enlarging this diagram, you can see the first step is similar. Mesenchymal tissue differentiate and not forms osteoblast, or it will form the cartilaginous model, so it will form chondrocytes, chondroblast. Okay, now the second step is cartilage model will lead to the formation of future bone. Perichondrium will form. Capillaries will start penetrating and transform inside the periosteum, and primary ossification center will develop in the center or the shaft of the bone. The later step is cartilages and chondrocyte continue to grow at the ends of the bone, and secondary centers of ossification will appear at the epiphyseal ends of the bone. Okay, now one of the end of the bone will fuse first, and the other end of the ossification center which appears first will later fuse. So that is the growing end of the bone, and there is epiphyseal cartilage form. Okay, ossification of the epiphyseal cartilage remains at the epiphyseal growth, and the joint surface and ultimately articular cartilages has been formed. So what you can see, the steps, these are the steps where the bones are being formed. The first is the first step is similar for both mesenchymal or mesodermal formation of the bone, that is from the mesenchyme, and next in case of enchondral ossification, the cartilage is formed first, and later on ossification centers appear, primary and secondary ossification centers appears, and later the adult bone is formed. So my dear aspirants, so see here, now let us talk about the bones which is having both type of ossification, membrano cartilaginous. So the bones having both type of ossification. Certain bones are there where the bones is having both type of ossification, that is called as membrano cartilaginous bones. Okay, so these bones examples are clavicle, which is having both type of enchondral and membranous ossification. Other example is occipital bone. Also the mandible bone is having both type of ossification. The other is the temporal bone, the sphenoid bone. Okay. Now let's talk about the basics of ossification. So I would like to tell you about certain basics of ossification. So like ossification, so first thing is that ossification center. When is the ossification center appear? So we have got two ossification center which is shown here in the shaft. We have got primary ossification center and we have got secondary ossification center. So as you can see in the diagram, a part of the long bone has been shown, and in the shaft of the long bone there is primary center of ossification, and the ends of the bone is showing secondary ossification center. Okay. So primary center of ossification appears before birth. So it is important to know that primary center of ossification appears before birth. So but there are certain bones in which is not following this and they are voiding the law of ossification. So I would like to give the example of such bones. So write down primary center of ossification is first to appear, and the timing of their appearance is before birth. Before birth, that is before approximately it appears by 6 to 8th week of intrauterine life. 6 to 8 week of intrauterine life. Okay. Now exception to this, if we talk about the exception, if I talk about the exceptions of the bones which is not following the this law, so we have got certain bones in which primary center of ossification appears after birth. So please note down, the bones are cuneiform. So these are tarsal bones. So we know that there is cuneiform bone. So cuneiform bone, we have got three cuneiform. So cuneiform medial, cuneiform lateral, cuneiform intermediate. So three cuneiform bones we have got, and we have got also the navicular bone. So these bones are not following the rule of ossification. Here the primary center of so exception why? Here the primary center of ossification is appearing after birth. So Here the primary center of ossification is appearing after birth. Now, so if we talk about medial cuneiform, its primary center third year. By third year, the primary center of ossification appears. If I talk about cuneiform lateral, 1 year. If I talk about intermediate and that of navicular, both of its 4 year. Both of year after the birth, 4 years of age, the primary center of ossification appears. Now, let's talk about the other one, that is the secondary ossification center. So, if I talk about secondary ossification center, it appears after birth. So, but there are exception to these also, like a lower end of femur and sometimes upper end of tibia. The secondary center of ossification appears along with the birth. So, write down secondary center of ossification. Secondary center of ossification appears after birth, but in this category also we have got exception. So, exception to this is lower end of femur and upper end of tibia. Lower end of femur and upper end of tibia. So, here the secondary center of ossification appears along with birth, that is 9th month. So, generally secondary center of ossification which is appearing at the ends of the bone will appear after birth, but it will appear along with the birth, that is 9th month, just before 9th month of intrauterine life. Okay, just before or along, you can say just before or along they appears. So, they are voiding this rule. Other important thing is that also I would like to write, so there is a direction of Newton foramen, and before that I would also like to write the law of ossification, and then I would like to explain the direction of Newton foramen. So, write down law of ossification. Law of ossification. The epiphyseal center which appears first, the epiphyseal center which appears first will unite or fuses last or later. Okay, this is the one step of it. The second law, the second point of this law of ossification is the epiphyseal center which appear later, which appears later will unite first, or fuse first. So, this is the law of ossification, and there is a bone. So, sometimes this law of ossification is also overruled and it is not followed. So, in case of the bone, that is the fibula bone, the distal end of fibula bone, what happens? So, दो ends होंगे. For example, if this is a bone, this is a long bone, it will have an upper end and it will have a lower end. So, at upper end, if the ossification center appears at, secondary ossification centers appears at 1 year and lower end में 4 year में, तो upper end में appear first हुआ है तो fuse भी later होगा. So, it will fuse by 20 years and lower end में अगर 4 years पे appear हो रहा तो it will fuse first by 18 or 16 years. So, this is the law, but this is not applied in the fibula bone. In the fibula bone, what happens? The distal end of the fibula bone, the secondary center which appear first unites first. So, please note down, distal end of fibula bone does not follow this law, Okay. So, there is the law not followed, and what happens here? Here what happens? The secondary center at the distal end, the secondary center at the distal end appears first and also unites first. So this distal end of fibula is not following the law of ossification. Now let's talk about the direction of Newton foramen. So let's talk about this. The other important point which I want you to explain about the Newton artery foramen. So let me just explain this point. So my dear aspirants, in this diagram you can see the direction of Newton foramen has been shown with the arrow. This is exactly the arrow showing the Newton foramen location. These are the location of Newton foramen. Okay. So if I rub it also, you can clearly see. Okay. Now, so actually if we see the direction of Newton foramen is towards the direction of the Newton artery where it is traversing. So direction of Newton foramen is always away from the growing end of the bone. So please note down, direction of Newton foramen is away from the growing end of bone. And for this also, so there is a mnemonic and there is a diagram which will help you to show towards the elbow I go and away from the knee I flee. That is the direction of Newton foramen. So please see this. So see here, the yellow color lines which is shown here is showing you the direction of Newton foramen. So direction of Newton foramen. Direction of Newton foramen will follow this rule. To the elbow I go and from the knee I flee. Got it? So that means in case of upper limb, in case of upper limb, what happens? Shoulder and the wrist are the growing ends of the bone. So write down in upper limb, shoulder and wrist are considered to be the growing end of the bone, and in case of in lower limb, so I am talking about limbs. So in case of lower limb, as you can see here, the arrow is marking towards the lower end of tibia and fibula and towards the upper end. So in lower limb, lower end of femur and upper end of tibia and fibula, these are considered to be the growing end of bone. So I think this diagram is making you understand this rule. So that is important for you to understand. Yeah. So with this, I can conclude this session of the bone because it was taken in 2 sessions. So those who have missed out the first session, they can see Saturday 8 PM में मैंने bone का general anatomy cover up किया है, the first part. This is the second part of the this is the second part which we have covered up today of the bone general anatomy. Before ending the session, I would like to give you the information of the upcoming session. So my dear aspirants, 2 sessions of special classes I am taking today on the Unacademy app. For this, you can download the Unacademy app. You can find your goal as the NEET PG and you can present live for my sessions 6 PM and 7 PM sessions, 2nd and 3rd of the histology session. This will be highly beneficial for you. First, you have to download the Unacademy app and then you have to find your goal as NEET PG. Then you can come for my session. You have to use the code ANAT10 as an unlock code for being present in the live session. The link of the session is provided on the Unacademy Telegram group. Also, these are the whole session details which I have covered up from 3rd of January to 7th January. 8th and 9th January session link will be provided subsequently, and also the topic for the entire week. Now, my dear aspirants, before ending the session, I would also like to show you this slide where the pricing detail of Plus and Iconic has been compared. Interested student who want to take the subscription of Unacademy, they can use my code ANAT10 and avail an extra discount of 10%. That means a total discount of approximately 20%. So just go for it and grab this opportunity. I would also like to, before ending the session, I would also like to thank you and do subscribe, like the channel, and you can download the PDF notes in the Unacademy free session. All the best, keep studying. So I will come up with the upcoming sessions and will let you know. So you can You can follow me on the Unacademy app for the links of all the sessions provided. Thank you. All the best. Keep studying.